Today we are celebrating hearing. Hearing care for all means that we take into account all types of hearing impairment. One that is not systematically and properly evaluated is auditory processing disorder, APD. The European APD group made this short video to raise awareness in the community. A master's program dedicated to APD will run from this October at the Medical School of Aristotle University of Thessaloniki, Greece. Screen, Rehabilitate, Communicate is the theme this year as suggested by World Health Organization. Screen is the first step. We should screen for hearing status in all newborns, children before going to school, adults, the elderly, children with learning disabilities, individuals with memory issues, and individuals with communication issues. In case we do not screen, we miss different types of hearing impairment that negatively impact children and adults on their social, academic, and work life. Screening can be implemented by different methods, from specific standardized questionnaires to an audiogram, autoacoustic emissions, and speech and noise hearing tests. Screening is usually done in a quiet room. When screening indicates hearing impairment, diagnostic referral will provide us with the specifics. The evaluation is elaborate, includes medical history, main difficulties, takes into account presence of other disorders, memory and attention abilities, focus as well, and ensures that the individual tested understands the instructions given on how to respond to auditory stimuli. If an auditory processing disorder, APD, is diagnosed, the best approach is to provide individualized management with a focus on auditory training. This uses the neuroplasticity of the central auditory nervous system. A re-evaluation usually takes place 6 months later, showing in the majority of cases auditory processing improvement or complete rehabilitation. Keeping a steady schedule, 2 to 3 sessions per week, is the most important factor. It is important to realize that once auditory processing is within normal limits, communication and learning difficulties do not instantly disappear. They need more time, as shown in the diagram. The relationship is longitudinal. Time is an important aspect. The greater time a hearing impairment is present, the greater the negative impact present on communication and learning. So it takes time to remedy. The first step, however, is to treat any existing type of hearing impairment, APD included. When testing for hearing, APD should not be ignored. Both screening and diagnostic evaluation needs to include auditory processing testing as a first step for successful rehabilitation. Hearing is much more than we are currently testing. Do visit our page at APD Seminars for the European Consensus paper on APD and many more papers and events from our European APD group.